Leukemia types. Leukemia is the most deadly cancer in the world as of now. Leukemia, which is also cancer of the blood, is known to kill in hours after it gets to its final stages. Leukemia types differed from one another in respect to their symptoms and treatment options used under each type. In addition to leukemia being a deadly disease, it is also quite hard to treat. This is because of the fact that the method of attack of leukemia is usually in the bloodstream and blood composition. This medical condition begins in the bone marrows and is spread all over the body through blood circulation. The importance of bone marrow cannot be underrated under any chance. The bone marrow enhances the efficiency and operation of different blood components such as the red, white blood cells and platelets. Red blood cells are used in the supply of oxygen in body cells and tissues, while the white blood cells are used in disease immunity in the body. Platelets are used in blood clotting. Any disruption to these activities like that one caused by different leukemia types easily results in death. Medical view of leukemia. Leukemia is a medical condition occurring in different types. Leukemia types are distinguished through their effects and symptoms. Leukemia is defined medically as a cancerous condition in the blood that mainly affects the soft bone tissues and bone marrow. This attack by different leukemia types leads to complete hindrance of the functions of the bone marrow, thus causing a disruption in the metabolic processes in the body. Leukemia types impose different effects in the bone marrow, with the most severe effect being the growth of tumors in the bone marrows. This makes the treatment of leukemia quite hard and impossible in most situations. Therefore, most of the leukemia patients end up dying within the first 24 hours after the disease gets to its final stage. Leukemia types such as acute leukemia are known to cause death even within 12 hours.
Types of leukemia. Leukemia types prompt the bone marrow to embark on a massive production of abnormal white blood cells. These cells are produced in excess and as such overcrowd the normal white cells, thereby hindering their efficiency. In the short and long run, the overcrowding of the abnormal white cells on the normal white cells leads to anemic conditions. It can also result to the spread of these cells around the body through circulation of blood and other body fluids. Leukemia types are several and are grouped differently according to their rate of spread and effects.
Acute leukemia. This is one of the most severe leukemia types in the present day. It is also referred to as chronic leukemia. This type of leukemia spreads pretty fast and in a vigorous manner. This type of leukemia is very mild in its early stages and may take a couple of months or years before it shows. This subgroup of the different leukemia types in the medical arena is very destructive. Doctors note that the disease may take a few years to build up, but after it builds up, it takes a matter of hours to kill you. It is one of the terminal diseases in the world today. As common in other leukemia types, acute leukemia spreads all over the body, thus infecting multiple organs such as the lymph nodes. When the disease gets to such a stage, treatment and efforts to counter the spread are usually fruitless. The leukemia abnormal cells cannot perform any activity either of the red or white blood cells or even the platelets.